Mr. President, earlier today, Majority Leader McConnell came to the Senate floor to once again be critical of the Affordable Care Act, a law that has resulted in more than 20 million Americans gaining health insurance. The law has lowered the uninsured rate to the lowest in American history. This law has put an end to insurance discrimination based on pre-existing conditions or gender. A law that has made sure that Americans suffering from mental health or substance abuse addiction can get treatment. A law that extended the solvency of Medicare by a decade and decreased prescription drug costs for seniors by more than $1,000 for each senior in America. A law that has helped to cut in half the number of bankruptcies filed in America because so many were the result of medical bills that people just couldn't pay. I was proud to vote for this law. Is it perfect? Of course not. Can it be improved and strengthened? Yes, it should be. Improvements can be made the same way we've made improvements in Medicare, Social Security, and so many other programs over the years. Not by repealing Social Security, not by repealing Medicare, but sitting down on a bipartisan basis to try to find a way to make sure that we don't deny health insurance coverage to 23 million people in America because of the repeal of the Affordable Care Act. To find a way not to raise costs on older Americans, which the bill that passed the House of Representatives would do, and to find a way to make this law better for people living in rural America. My hometown's in downstate Illinois. I, as a congressman and senator, have represented a lot of small towns in sparsely populated counties. They value many things. They sure value their schools and their basketball teams and football teams, but I'll tell you what they value as much, if not more than anything else, their local hospital. The local hospital makes such a difference in small town America. It's not only a lifesaver, saves you from driving another 50 or 100 miles for quality care, it's also a source of great employment. Probably the best paying jobs in town are at the local hospital. And if you want to keep a business or attract one, a local hospital is a good selling point. Do you know what the bill that passed the House of Representatives will do to the rural and small town hospitals in Illinois? Don't take my word for it. Ask the Illinois Hospital Association. They anticipate losing 60,000 jobs in Illinois because of the bill, health care repeal bill, that passed the House of Representatives. And they know that many hospitals downstate and many in the inner city are going to be forced to cut back in services, if not close, as a result of it. What can we do to make this a better bill, to make the Affordable Care Act work more effectively? Let me give you a couple ideas. First, we don't have anything in the law today which deals with prescription drug prices. We are at the mercy of people, pharmaceutical companies, investment bankers, and others who come in control of these pharmaceutical patents. They can literally raise the cost of these drugs beyond the reach of many families. I had a young man come see me. He's in high school. He's been fighting diabetes since he was a little boy. And he and his mother talked about the dramatic increase in the cost of insulin that he has faced over the last several years. Insulin's been around a long time. This is not a new wonder drug. It's a critical, life-saving drug. But the prices and costs of insulin are going through the roof, and there's no way under current law for us to deal with it. Should we take that up? Of course we should. Blue Cross Blue Shield in Illinois told me recently they spent more money last year on pharmaceutical costs than they did on inpatient hospital care. And the costs continue to go up. We need good life-saving drugs. We need to reward the companies that find them with a profit. But those who want to gouge prices and take advantage of people in modest income or folks that don't have insurance, there's got to be a way to answer that and to deal with it honestly. Yesterday, I went with 8 other senators out to the National Institutes of Health. It's out in Bethesda, Maryland. It is the premier medical research facility in the world. We're lucky to have it right here in the United States. Time and again, they told us about breakthrough drugs that were making a big difference, that started with research at the National Institute of Health. I asked at one point, is it too much to ask the pharmaceutical companies that take your basic research idea and turn it into a profitable product to give some of those profits back to the NIH to continue their research? They said, we've tried to do it, but the pharmaceutical companies walk away. they don't want to give us a penny for our future research. Well, that's wrong. We ought to be investing in that research, rewarding the pharmaceutical companies for their development of these products as well, but making certain we continue this leadership in the world when it comes to medical research and pharmaceuticals. The individual market on health insurance is one that troubles us because it's the area where people who don't have health insurance through their place of employment or don't qualify for a government health insurance plan like Medicare, Medicaid, Veterans Care, and the like, this is where they go to buy insurance on the insurance exchange. And this is where the premiums have gone up. Now, why have the premiums gone up in that one sector? Because when it comes to individuals, those who are older and sicker are the first to sign up. But the healthier, younger ones are the last. We can sit down on a bipartisan basis and find ways to create an incentive so that we can bring down, increase the participation in this insurance pool and bring down the premium costs for those who are paying. The third thing we need to do is to make sure that no matter where you live in the United States, there's an option to choose when it comes to buying your health insurance. One of the things we can do is to take one of the most popular medical care programs in history, the Medicare program itself, and duplicate it in an option, a public option available to people across the United States. Do you want to buy a health insurance program that looks like Medicare, a not-for-profit program? This would be your chance. So those are three ideas that I think we could bring forward in an effort to make the Affordable Care even more responsive. Senator McConnell, the Republican leader, comes to the floor frequently to talk about the choice to expand the Medicaid program as allowed under law in many states. I would welcome the opportunity to expand that program. Most people do not understand the Medicaid program. Oh, that's health insurance for poor people. Well, in a way it is, but it's so much more. For example, 1 out of every 2 births in Illinois is paid for by the Medicaid program to keep mom healthy so she delivers a healthy baby and to keep that baby healthy as soon as it's born, paid for by Medicaid in 50% of the cases of new births. But that's not the most expensive thing. The most expensive thing under Medicaid is for your mom and your grandmother who's in a nursing home, living on Social Security and Medicare, and they need help. So they qualify for Medicaid to pay for the medical care they need so they can continue to live wholesome lives. Third area, of course, is medical insurance for the disabled who have ongoing needs. Those 3 areas make up Medicaid. And when the Republican proposal that came out of the House wanted to cut $600 or $700 billion, give tax cuts to wealthy people, they took it out of Medicaid. So which of the groups that I just described to you would you take health insurance away from? Mothers with new babies, elderly folks in nursing homes with no resources, or the disabled who live in our communities? I would think it's a step in the wrong direction to hit any of these groups. That's why Medicaid was expanded in so many states and why we should continue to find ways to expand it in a responsible fashion. Mr. President, as I go back home and talk to people about this Republican alternative that passed the House of Representatives, it is very clear they oppose it. I have challenged those congressmen who voted for the Republican repeal bill to find one medical advocacy group in my state that supports their effort. There are none. The Illinois Hospital Association, the Illinois Medical Society, the Illinois Nurses Association, the Illinois Pediatricians all oppose it. And AARP, American Association of Retired Persons, opposes it because the bill removed the protection for elderly people when it came to the cost of premiums. AARP believes, and I'm afraid the facts bear it out, that what passed the House of Representatives will dramatically increase health insurance premiums for people between the ages of 50 and 64. We can do better, but we need to do it on a bipartisan basis. Mr. President, I yield the floor.